Now, criticism of the COVID response has been coming thick and fast as case numbers continue to rise. The New Zealand Medical Association, who represent GPs, and Apex Union, who represent medical lab workers, have recently joined the list of organisations expressing their concern at the state of New Zealand's COVID response. But Minister for Health Andrew Little is playing down these claims, and he joins us now. Good morning, Minister. Thanks for joining us. There's been a lot of focus on whether hospitals are ready, but community healthcare workers and GPs say that they're at crisis point. Have they been neglected?
No, not at all. In fact, GPs have been integral to the planning and preparation for the response, actually for some months now. We've had GP representatives on the group doing the actual planning. We also have an assurance group who kind of checks and tests everything that the planning group is doing. That's had a GP representative on it as well. Any claim that GPs haven't been actively involved right from the outset in planning and preparing for the COVID response is just wrong.
Right, but is there a staffing crisis going on? I'm hearing that in some agencies, nurses are being told that even if they test positive for COVID, if they are asymptomatic, there is so few people available to work that they can go to work and treat people, even if they're positive but asymptomatic. Is that happening?
I'm not sure whether that is happening, and there are protocols for DHBs to manage their nursing workforce and the total health workforce. What I can say is that, yeah, we know there is a shortage of nurses. There are a large number of nurse vacancies around the country. That's been a major problem for some considerable time. We've started the work on filling those gaps, on a recruitment campaign, on increasing nurse pay, so that we can fill those gaps with other health professionals too. We know there are shortages in many disciplines. Again, that work on filling those vacancies, filling those gaps has been ongoing for some time. The DHBs, in terms of managing their patient workload and the patients coming to the hospital, they've got protocols to deal with that, not only to keep patients safe, but to keep staff safe as well.
And so would you be comfortable with COVID-positive nurses who are asymptomatic, but COVID-positive nurses working in hospitals or with patients?
I think you look at the last 2 years of COVID in this country and what has happened in our hospitals, there has not been a staff to patient transmission of COVID in all the time we've been doing that. The reality is, in spite of what some representative organisations are saying, the way DHBs have managed COVID, particularly those Auckland ones, because they've been at the epicentre of this, the way they have managed COVID and the keeping staff safe and keeping patients safe has actually been one of the best track records in the world in terms of keeping people safe, and I stand by that.
OK, I can see you're at the airport this morning. So a question on the border. In about 4 days, we're going to have people come through from Australia that are not going to have to MIQ. If they come through with rapid antigen tests, are they going to have their bags searched and have those tests taken off them?
I'm not quite sure what you're getting at there. If people bring whatever they bring, as long as it's not contraband, they can bring it across the border, including rat tests. I think what we have in this country is made sure that the rat tests that are available, that businesses are using, that pharmacists and health professionals are using, and that will possibly be available at retail, have been checked and approved by the ministry as actually reliable. The problem with the rat tests is that we know that generally speaking, they have about an 80% accuracy rate. You want to make sure that the best rat tests are available, because even with that level of accuracy, that still poses some challenges, but we want to get the best rat kits available, and they're the ones that will be available in New Zealand.
But if you can come through the border with rat tests from other countries, what's to stop people going and importing them that way themselves?
Well, if travellers bring in their any rat kits, that's a matter for them. But and look, there are some organisations trying to import rat kits at the moment. The reality is there is a worldwide shortage. There is huge demand. The Ministry of Health has managed to get quite a few million rat kits across the border to be available for testing. We want to make sure that those who need rat kits are getting them so they can get tested and check whether or not they can get to work, check whether or not they've got COVID. So we actually want it for people who need it. We know there are a lot of worried well around who just want to be tested. That's actually a waste of those kits. We want to make sure they're going to where they need to go.